Welcome. My name is Dee. I'm a virtual fitness specialist with Premise Health, and today I'll be talking about osteoporosis and strength training. My journey in fitness is fueled by my desire to uplift others in their pursuit of optimal health and fitness. Join me as we explore the impact of strength training and bone health. So today we're going to go over what osteoporosis is, the connection between strength training and osteoporosis. We're going to go through some targeted exercises, and we'll end with final tips, takeaways, and frequently asked questions. So what is osteoporosis, and why is it called the silent disease? Osteoporosis is a medical condition in which the bones of the body become extremely weak and brittle, predisposing the individual to fractures. The bones most commonly affected with osteoporosis are that of the hip, pelvis, and the wrist. Osteoporosis is seen more in women above the age of 30, but men also tend to have this condition. Osteoporosis is a progressive skeletal disease characterized by reduced bone mass and bone density. It is a silent disease as there are no symptoms prior to a fracture. The prevalence of osteoporosis increases remarkably with age. Osteoporosis literally means porous bone. Porous meaning full of holes. Osteoporosis is initiated by an imbalance between bone reabsorption and bone formation. Bone loss happens because your bones are in a constant state of remodeling. Throughout your life, your body removes older, damaged bone and replaces it with new bone. So as you get older, your body starts losing bone faster than it can make new bone. And as we age, our bone gets thinner. And as our bones lose density and become more porous, it becomes harder for them to maintain their shape and structure. Some risk factors include your risk increases with age, especially after menopause in women. Women are more susceptible than men. Hormonal changes such as decreased estrogen levels in women post-menopause, and inadequate calcium and vitamin D intake. Strength training and osteoporosis, enhancing your quality of life. These type of activities are often recommended for people with osteoporosis. Strength training exercises, especially those for the upper back, weight-bearing activities like walking, flexibility exercises, and balance. Strength training includes the use of body weight, free weights, and resistance bands to strengthen muscles, tendons, and bones. Strength training is especially helpful to build the back and core muscles that are important for posture. It also can help support bone density. You or a fitness specialist should tailor your strength training to your ability and level of comfort, especially if you have pain. Speaking with a fitness specialist can help you learn to use proper form and technique to prevent injury and get the most from each workout. Weight-bearing activities involve doing exercises on your feet with your bones supporting your weight. Examples include walking, dancing, elliptical training, stair climbing, and gardening. These types of exercises work directly on the bones in the hips, legs, and lower spine to slow bone loss. They also improve blood flow and are good for the heart. Even though aerobic exercise is good for overall health, it is not all you should do for exercise. It is also important to work on strength, flexibility, and balance. Swimming and cycling have many benefits, but they don't provide the weight-bearing load that the bones need to slow bone loss. However, if you enjoy these exercises, do them. Just be sure to add weight-bearing activity as well. Flexibility exercises, moving your joints to their full range of motion, helps keep muscles working well. Stretches are best performed after muscles are warmed up. For example, it's good to stretch at the end of an exercise session or after a 10-minute warm-up. Stretches should be done gently and slowly and without bouncing. Balance exercises help prevent falls and are especially important for people with osteoporosis. Stability and balance exercises help muscles work together in a way that makes falls less likely. Exercises that improve stability and balance include standing on one leg and movement-based exercises such as Tai Chi. Some exercises to avoid include bending and twisting. And some people who have osteoporosis, bending forward at the waist and twisting at the waist can increase the risk for broken bones in the spine. Exercises you may want to avoid include touching your toes or doing sit-ups. Some other activities that may require you to bend to bend or twist forcefully at the waist are golf, tennis, bowling, and some yoga poses. Targeted exercises and strength training help improve muscle strength and muscle function, which lead to greater mobility and improved quality of life. An exercise program for people with osteoporosis should specifically target posture, balance, gait, coordination, and hip and trunk stability, rather than general aerobic fitness. A fitness specialist can recommend an exercise program suited to your individual needs and capabilities. Exercise plays a vital role in bone health and osteoporosis prevention. This is because bones and muscles respond and strengthen when they are stressed by weight-bearing or impact exercises. Exercises can also help people who have fractured bones regain their mobility and strength. It's never too late to start exercising. Exercising if you have osteoporosis means finding the safest, most enjoyable activities for you based on your overall health. There's no one-size-fits-all prescription. Targeted exercises strengthen the muscles needed to keep you upright and improve balance. You should aim for 8 to 12 repetitions of each exercise. When performing these exercises, hold on to a railing, the back of a sturdy chair, or a countertop for support. To make each exercise more challenging, you can start doing more repetitions or performing the movement without support, or holding on to weighted objects. Sit to stand. The chair sit to stand is beneficial as it strengthens the key lower body muscles and improves functional mobility, aiding in tasks like getting in and out of chair, raising from a chair, and performing daily activities with greater ease and reduced risk of injury. Start by sitting at the front of a sturdy chair with your feet flat on the floor, hip width apart. Lean slightly forward and shift your weight onto your feet. Initiate the movement by pushing through your heels and driving your hips forward and upward. As you rise to a standing position, keep your chest lifted and avoid using momentum to stand up. Control the movement by pushing evenly through both feet and maintaining a smooth, controlled motion. The squat is beneficial because it targets multiple muscle groups, including the quadriceps, hamstrings, glutes, and core, enhancing overall strength and stability for activities like lifting, climbing stairs, and maintaining proper posture during everyday movements. Ensure that your feet are shoulder width apart, toes are slightly turned out, and knees are tracking over your toes throughout the movement. This alignment helps distribute the load evenly and minimizes the risk of injury. Initiate the movement by pushing your hips back as if you're sitting into a chair. This helps to engage your glutes and hamstrings while preventing excessive stress on your knees. Focus on pushing through your heels as you rise back up from the squat position. This engages your posterior chain muscles, your glutes, hamstrings, and lower back, and helps you maintain balance and stability throughout the movement. The overhead press is beneficial as it strengthens the shoulders, triceps, and core, facilitating activities such as lifting heavy objects overhead and placing them on high shelves, such as groceries, and maintaining shoulder stability during various daily tasks. Grip the dumbbell or barbell with your hands slightly wider than shoulder width apart. Place the weight directly overhead in a straight line, extending your arms fully without locking out your elbows. Focus on keeping your wrists straight and your shoulders down away from your ears. Throughout the movement, maintain tension in your core and lower body to stabilize your torso. Avoid arching your back excessively or leaning too far backward. Push through your heels and keep your glutes engaged to provide a stable base for the overhead press. Some final tips and takeaway. Osteoporosis is a disease caused by low bone density, which is more common in women than men. Regular exercise can help to build and maintain bone muscle and strength, improve strength and balance to help prevent falls, and certain types of exercises strengthen muscle, while others can improve balance and help prevent falls. Think about what kind of activities you enjoy most. If you choose an exercise you enjoy, you're more likely to stick with it over time. And some frequently asked questions. How many times a week should I lift? To maintain the basic health in 2 sessions per week with 8 to 12 repetitions of 8 to 10 exercises targeting major muscle groups. Can you lose weight doing weights, or should I focus on cardio? If your calorie expenditure outweighs your calorie intake, you'll lose weight. But remember, the weight you see on the scale is just a numerical reflection of your weight with gravity. Will I get bulky? It is unlikely that lifting weights will result in big bulking muscles. Building muscles require a great deal of targeted high volume strength with meticulous nutrition practice. Cardio or weights first? If you're looking to improve strength, then you'll start with strength. If you're looking to improve your endurance, you'll start with cardio. And if you're looking to lose weight, you'll start with strength as well. And thank you all for coming.